I think that the chamber can be whatever you need it to be, and all you have to do is ask. You know, I think we are willing to really go the extra mile if that's what you need, or to just stand by your side and support you through your established efforts if that's what you need.
Hello, and welcome to the Connect podcast, a podcast by the Holdrege Area Chamber of Commerce. Today we're joined with Holly Rahmann from Phelps Memorial Health Center. Really excited to get started, and I know you can see this treat in camera view. I can smell it, so I've got it twice as bad as you guys do. But we're gonna wait till the end of the episode to try this out so we don't have a bunch of chocolate on our teeth while we're answering questions for you. But how are you today?
Hey, I'm great. How are you, Adam?
Good, I'm really good. I'm actually really excited I got a chance to sit with you. For those that don't know, when I got hired here, well, before I got hired at the chamber, you sat in on my interview. Mm-hmm. And since I've started here, you know, obviously my job is really involved in marketing. And so I've always kind of wanted to brush my ideas to you and be like, how do you feel about that? Before we ask any of the real crazy questions, do you want to talk a little bit about your journey to where you are now and kind of how your career started?
Sure. So I grew up in Northwest Oklahoma. My whole family still lives in the area down there, and so we visit there frequently. But my undergraduate degree is from Oklahoma State University. Go Folks. And I actually had to have a degree in agricultural communications. I tell people often that that's really just a communications degree where the work that you did was maybe more agriculturally focused in school, and planned to always have a career in the agricultural industry. That was where I started. And so I took a job right out of college in 2007, wherever I could get one, because things were a little challenging at that time. But worked for a cattle organization, a breed organization in the Kansas City area, and really enjoyed that work. Feel at home with cattle people in the cattle industry, but had the opportunity to get out of the city. I really am a country girl at heart, and I enjoyed that period of time, but wanted to get back to a rural area in way of life. And so I was looking for jobs in the Midwest, in more Kansas, Oklahoma area, but was open to just whatever seemed to make sense. I landed a job at Central Nebraska Public Power and Irrigation District here in Holdrege, and spent 10 years working as their public relations assistant. Loved that organization. Learned a lot about agriculture in Nebraska, water resources, natural resources, energy and electricity, the people, the community, the state. Yeah. And traveled around the state a little bit. Their system reaches from Lake McConaughey, Ogallala area to almost to Hastings, to Adams County. Wow. So had the opportunity to learn a lot, grow in my career. Thought I would be a lifer in kind of agricultural communications and relations, maybe a little advertising, marketing, social media, website work, that kind of thing. And I was approached by a friend that I have that knew me from some of the work that we had done at the same time, career fairs and things like that. And she reached out and said, hey, I think this job at the hospital sounds like something you might be good at. You should apply. And I thought, why not? You know, whatever. Yeah. I am a firm believer in always keeping your options open and just looking for opportunities that come your way. Yeah. And so I reached out and applied and got the job in the height of COVID. Wow. Yeah. And so October of 2020, I started at Phelps Memorial Health Center as the Director of Marketing and Business Development, and didn't realize what a gift that opportunity was going to be for me at the time. My mother is a dentist, and so I grew up thinking and knowing a little bit about health-related activities and understanding the thought processes of someone who thinks very clinically and also prioritizes taking care of people for a living. And so I felt a little at home at the hospital, but very out of my element from a professional training standpoint. Sure. But I learned that an upbringing and a prior career in non-healthcare industry related activities has actually brought me to sometimes a higher level or a different approach of thinking in the healthcare industry and the role that I'm in now, because I wasn't trained to think like my peers or my colleagues.
Right.
And so it's kind of refreshing sometimes, also challenging sometimes, to get us all on the same page. But the Phelps Memorial Health Center and Phelps Medical Group and the whole healthcare industry in Holdrege is unbelievable. The forward-thinking, kind of community-minded business structure, the engagement with community, the engagement within the teammates at the hospital is, I just can't even explain how incredible it is. And so I think the atmosphere is very intentional. It's very service-driven. It's very caring and dedication and focused to just providing the service that they're really committed to providing. And I love that I get to tell everyone how great it is there.
Yeah.
You know, that is really my role and my team's role in just getting to tell the story and to shine a light on the good that is happening in our community and in our industry. And then also kind of now my new role as a strategy and communications leader is to get to figure out how to keep doing that.
Yeah.
So that's really fun.
Yeah, we were talking a little bit before we started rolling. A lot of the times when you are talking, and I'm glad you said that too, that your background is a little different than your peers. Mm-hmm. Because when we talk on some chamber business, it's usually not from a marketing perspective. It's usually very strategic. And so I think that's, it just speaks to the multifaceted way that you run things that you do. How similar is Holdrege to where you grew up in Oklahoma?
Yeah, I would say a lot of differences in things like population, type of, we grow wheat and raise cattle in Oklahoma. We grow corn and soybeans and raise cattle in Nebraska. The type of people, though, from a rural community, that the way that a small town has to kind of lean on each other and depend on each other and to really care about each other, even if it's someone that you don't maybe have like a personal relationship with, but are just more invested in the success of your team or your community or your school system or your business. If you're a business owner, the reliance that you have on those relationships with your citizens of your community is life-changing, and that is very similar. You know, I think small town, rural America, I mean, it's all the Midwest, maybe it's a little Great Plains kind of region, I guess you would say, but I feel very at home here. I think I've made this my home. I struggle. I still go and visit my family often and do feel those deep connections to Northwest Oklahoma, but this is my home and these are my people.
Yeah, no, I love that. You spoke a little bit about Phelps Memorial Health Center being so involved with the community and community-minded and really forward-focused. And me and my role here at the Chamber, I get to see it firsthand. I work with a lot of you guys on, the festivals that we have coming and other Chamber stuff that we do. But from your perspective, what makes a hospital like Phelps Memorial so vital to a community like Holdrege?
The hospital and its leadership have very much invested in the right things for this community historically. I think years ago, over 10 years ago now, they came up with this kind of unique concept for a rural critical access hospital and decided that instead of seeing the minor things here and sending patients to bigger towns for their kind of complicated needs, they knew that healing happens best at home. And by bringing those surgeons to home, they knew their community and their patients were going to be better cared for. And that is the core of the success that the hospital has achieved and continues to see happen. And the other thing that they've done really well is to intentionally build a group of teammates, is what we call them, our team, that cares and understands what we're really trying to achieve, which is to make sure that our friends, our family, our patients, but those patients are our friends and our family, are cared for, and are cared for in a very intentional, loving way that is healing and doesn't ever cause more harm or anything negative. You know,
Yeah.
it's very intentionally positive, uplifting, and if you know, no one's perfect, nothing ever goes perfectly.
Right.
You can't make that like a gold standard, but the gold standard is to always work towards having the best outcome.
Yeah.
And I think our team all knows and understands that, and our community knows and understands and supports that. And with the concepts that have been so unique, that the community has been willing to accept and trust that those surgeons that they've never heard of before from, you know, another state or another community are the best surgeons. They come and support the business, and they trust that their primary care providers who do live here and do have a relationship with them are leading them in the right direction. And we have an incredible team of primary care providers who offer great insights and help us in leading the hospital in what's best for our community too.
Yeah. No, one of my questions was going to be what you would say to someone who may not realize how strong and capable our local healthcare system is. But you answered that right with that last sentence. I've also been at Rotary and other organizations like that where they have some of these specialists come in and just give a speech about what they're doing.
Right.
And so they care. They're not just coming here to save, I mean, obviously they're coming here to save lives, but they care about the community they're in too. And so I think that's special. One thing people may not know, which I'm sure they do, but you served as our 2024 Chamber Board President last year. From that seat, how do you view the Chamber's role and importance in a community like this?
Yeah, I think we've done some really deep thinking and kind of insightful learning about how the Chamber should be and wants to be and can be and now is supporting business and commerce and the economy in Holdrege and the surrounding communities. I feel like there are still many, many opportunities to come that we are excited about. And I know that as businesses learn to come together and work together to support one another, as large organizations and small mom and pop shops find their homes side by side, the community can be, you know, very successful and strong in those efforts. And I love that the Chamber is dedicated to supporting every individual business and community member alike, but really focusing on the resources that the businesses need to be successful, because that's what ultimately drives a very successful community.
Yeah. What are some things that you think people misunderstand about the Chamber?
When I started working here in Holdrege, actually, you know, was told, oh, we are going to have this event, call the Chamber, they're the party planners, you know, like they'll bring the people. And, you know, they were serving as that resource within our community at that time. And it wasn't a bad thing. It just wasn't what the community really needed from what a chamber could be. And I think we were a little bit visionary when Lori came on board here, and she had such great ideas and a willingness to just put those ideas to work, and built an exceptional team with Adam and Deanna, and a great, inspired great work within her board, and her volunteers, and her amazing lineup of all the wonderful community members who support our chamber. And while change can be hard, sometimes it can be really rewarding too. And so I think going from this kind of party and planning concept and that misconception of what the chamber should be to really understanding that the chamber is a connector of individuals and businesses alike, and knowing that the chamber is willing to take some risks and to be forward thinking and community minded, and to explore how others are doing it well, and to maybe bring those ideas here to Holdrege has been really fun and rewarding.
Yeah.
And I'm really proud of you guys for all the work you're doing.
Thanks. It's rewarding in itself. You know, everybody wants to make an impact. And so doing something and seeing it directly impact a business is just everything to me, myself, and I'm sure it is to Lori and Deanna as well. Just in a committee meeting this morning, we're planning Holdrege for the holidays. Shocker. And two different organizations that hadn't met before are going to team up to bring something to the Winter Festival. So awesome. I think just even those little connections are just the bread and butter for what I like to do. Yeah. What do you think you would say to a young professional that was considering joining the chamber here?
I think that the chamber can be whatever you need it to be, and all you have to do is ask. Yeah. You know, I think we are willing to really go the extra mile if that's what you need, or to just stand by your side and support you through your established efforts if that's what you need.
Yeah.
And I think the chamber being so willing to do what is needed for each individual, but also for the community as a whole, is what makes it so successful.
Mm-hmm. What opportunities do you see ahead for Holdrege when it comes to healthcare and workforce?
Mm-hmm. The industry is kind of in a funky place right now. COVID was really awful and also eye-opening. And I think the lessons that we learned from it were very valuable, but challenging to overcome, and have been challenging to find a new version of normal. We are doing our best to bring every service availability locally that we can here in Holdrege. And that is challenging because there are so many different health needs that exist. And one person's issues are completely different from someone else with the exact same diagnosis sometimes. Yeah. So, you know, as we work towards finding those solutions for the community, we always want input, but also some grace in knowing that not everything can happen perfectly all at once.
Yeah.
And I think we are really excited about what the future holds from an industry standpoint for a local critical access hospital, because there are so many system-based businesses that are existing, and those are becoming more and more common, but we have this great resource in our Rural Med Health Cooperative, which is a group of similar critical access hospitals across the state of Nebraska that help support each other, even just by offering, you know, examples of how we're doing something successfully, and asking for that feedback from other organizations as well. A lot of different variation in what each of those community hospitals are doing, but overall, learning from each other's mistakes and helping support each other through success is really helpful. And from an industry standpoint, we know that nurses, healthcare professionals are struggling to really find their fulfillment and their purpose at times, but also how those pieces of feedback or information or adjustments that we make to our workforce because of those challenges can actually get us to a better place in the long run. And by doing the best that we can to offer those opportunities for conversations to be had and to do things differently can be very helpful.
Yeah, no, I agree. Is there something you wish people knew about Phelps Memorial Health Center that they maybe don't?
I often think that people don't realize how many services we offer here in Holdrege. So we keep a pretty solid lineup on our website, phelpsmemorial.com. If you're wondering, you know, or just making assumptions, especially if you're new to the area, over what we have available at the hospital in Holdrege, there's not much that you can't find.
Yeah.
And we try our best to have them there very frequently. Most of our services are covered weekly, some of them daily, like our cardiology clinic. Our cardiovascular clinic has actual daily appointments. Our ortho spine clinic can be anywhere from every few days. We have a daily availability of local mid-level providers who are exceptionally well-trained and so knowledgeable, and have really close working relationships with our surgeons, which is kind of a model that we're using right now for many of our specialty services that are more necessary and needed. And it's working really well for us in having that local relationship with a provider for our patients, that resource, particularly for our cancer care in Stacy Van Boning as our local provider, and just the ability to have that relationship with someone who knows and understands what they're going through and lives in the same place that they do, and can see the challenges that they face, but still have the knowledge, the training, the expertise, and the resources and connections with the oncologists to help guide the patient through the challenges. But, we're trying to do that with as many service lines as we can.
Yeah.
And while it's not everything, it is everything that we can logistically make happen. But we're also open to new ideas if anyone has them. So bring them our way.
That's amazing. From a person who moved to this community from another community, it was mind-blowing, the things you can do in this community. For a town of 5,500 that you can be taken care of like you're in a bigger spot. So it's awesome. What is your favorite chamber event here in Holdrege?
I can't really say, I guess. I think every chamber event is fantastic.
Oh, that's a great PR answer.
No worries. My favorite event is the Midsummer Festival, formerly known as Swedish Days. I think that it is all-encompassing. Mm-hmm. So it has something for everyone, which to me is what makes it stand out above the rest. You know, we have some kind of evening activities that are softer on our initiation night, our first night of the event. We have loud, big, fun activities on our second night of the event with an outdoor concert series, which is super cool. And then we have all day family-friendly parade activities, games. We do have some of those historical moments and a nod to those Swedish traditions. Yeah. And our museum does an excellent job of helping us with that. Our senior center, so many great resources within our community to help drive that event and make it very successful. Yeah. So I think that's the best event. But I do think that all of the events have a level of significance and importance. A ribbon cutting for someone who had a dream and made it a reality, can be very life-changing. And so sometimes those are more small, less attended events than your 50,000, community festival for the weekend, but very important and impactful.
Yeah, I agree. And I wouldn't have agreed before I moved here and started working at the chamber. The amount of times there's 10, 15 people at a ribbon cutting and tears fly, right. It's incredible. And it is. It's a big celebration for someone who put their life on the line. So I agree. I'm glad you mentioned that. This is a fun question and kind of a full circle moment. When I was in my interview, you asked me and you caught me way off guard. You said, how important do you view communication in an area like this? So I'm going to reverse Uno card it. How important do you think communication is in an area like this?
Thanks, Adam. It would be no surprise. And I can't tell you how many times I've said communication is the only thing that makes, I don't know that it's the only thing that indicates true success, but without it or with poor communication, you will fail. Even if you only fail to tell people how you succeeded, you still failed. And so, I think maybe it's a little bit my natural, tendencies in being loud and outgoing and, forward. Or maybe it's my training and my background and my experience, or it's most likely a combination of the few. But I think if you are not prioritizing communications, you are not achieving the success that you could be. Yeah. Because sharing your story and sharing the details is what will get people to invest in you, to believe in you, to support you, to appreciate you. And if you're not communicating, how are you getting there?
That's exactly right. So, my favorite part of this podcast is the last question. And so I always ask the same question to every guest, and it's, what's one piece of advice that can be business advice, life advice, that you'd like to leave the Connect listeners with?
Well, I'm going to do two because I'm going to do a business advice and a life advice. Doubling down here.
Sounds great.
I think this is, today, so September 3rd, 2025, because when you're working in the communications and media industry, everything changes on a very quick pace. So today, my best business advice would be to build your Google profile. Your business profile on Google. So that is free. It is not complicated. If you are tech savvy at all, and if you're not, find the kid down the street that is and to help you. But that is just a basic informational hub for your business on Google. It says where you're located, shows somebody what you look like, can have a really great positive influence on the image of your business, or alternatively a negative one. It is where your reviews can lie, and spoiler alert, people can leave those reviews for you whether you build your profile or not.
That's right.
And so it's important for people to be at least aware of and keep a look at what their Google profile says about their business.
Yeah.
I was just talking to my mom about her dental practice, and she doesn't need marketing activities because her patient lineup is well established, but she does need people to see her business as valuable and realistic and profitable and successfve. And so we've been talking about working on her Google business profile.
That's amazing. That's something I feel like, it feels like beating a dead horse. I've posted it on Facebook maybe like a dozen times. It's like, my biggest tip is Google profile. I think it's often something people just overlook. They're like, oh, it's Google.
Or they don't know that they have the ability to edit it.
Yeah.
Yeah, I think, and it's free.
Yeah.
So, I mean, you can sure spend a lot of money with Google, absolutely, but you don't have to, you know, and I think even the free things can be very, have a good return on your time investment.
I agree.
My life advice would be this is kind of like a professional life advice, I guess I would say, career-driven life advice, but maybe just general life advice too, is to really figure out who you are as an individual, what your strengths are. I'm a big fan of personality tests and Myers-Briggs profile and Clifton Strengths Finder and the full gamut. If there's one that exists, I've probably taken it, you know, because I feel like I can never learn enough about myself. And if you are able to really have a clear understanding of who you are and you learn to lean on your strengths and to be good at what you do, you can be a lot more confident and successful in life. And that doesn't just apply to the work that you do. You know, it might actually help you be more meaningful in your personal relationships, your friendships, your parenting of your children, and to understand who your children are as individuals too can be so rewarding. So my best life advice would be to kind of figure out who you are and why you are the way you are, so that you can really know how to be the person that you want to become and feel good about it.
That's amazing. I don't know what it was called. I think it's called DISC assessment. Is that one of them? And I took one of those a couple of years ago. And the best part, I loved looking at my strengths, you know. But it was interesting for me to look at the weaknesses that I thought, might exist. And it actually, in a weird way, helps you strengthen those weaknesses too. So if you're aware of them. Well, the time has come for us to try this foot-long cookie. I don't know if I've let you guys know how excited I am about this, because I've seen, first of all, I love Subway cookies. I don't know what it is about Subway cookies, but they're amazing. Good. But every time I go into Subway to get a sandwich, someone's ordering this cookie. And I've not gotten it. So I'm excited to try it today. We're going to try it live here on the Connect podcast. Not live for you guys, but live for us. And you said you've tried this already.
I have,
right?
yeah. It's been a while since I had it though.
Really? So when did they just, it's like during the summer maybe? Or has it been a few years? Am I just way behind?
You're behind. I mean, not like a long time, but I think probably in the last couple of years I had one.
Wow, that is good. I should have got us milk too. We definitely need some milk to go with the chocolate chip cookies. No, that's delicious.
That was fantastic.
Yeah, shout out to Subway. Thank you so much for supplying that today. Holly, thank you so much for joining me and letting me pick your brain a little bit.
Sure.
And thank you guys for joining us and tuning in. We'll see you next week.